Bronchitis is a self-limiting inflammation of the trachea and bronchi, characterized by a persistent cough with or without fever. It is usually caused by a viral infection. Bronchitis in adults. Diagnosis. Clinical presentation includes an acute onset of cough lasting more than 2 weeks, typically lasting more than 5 days. This may include sputum production and shortness of breath, with or without fever. Generally, it is considered a mild condition. Bronchitis is usually a less severe presentation and is often self-limiting. On the other hand, pneumonia tends to be more severe and comes with systemic signs of infection. Symptoms of bronchitis can overlap with pneumonia, which can lead to inappropriate treatment with antibiotics, so this should be avoided. Bronchitis in children. Diagnosis. Acute onset of cough lasting more than 5 days, usually with a runny nose and mild fever, with no clinical signs of pneumonia. Generally, it's a mild condition, and the cough usually lasts 1 to 3 weeks. Pathophysiology. Acute bronchitis is caused by tissue damage of the bronchial wall and an inflammatory response triggered by the proliferation of microorganisms in the affected bronchi. Epidemiology. Acute bronchitis is a very common condition that can affect people of all ages, and it may be associated with frequent unnecessary use of antibiotics, smoking, exposure to air pollution, and during the seasons when respiratory viruses are common. Most cases of acute bronchitis are of viral origin, like pathogens such as rhinovirus, influenza virus, coronavirus including SARS-CoV-2, adenovirus, and other respiratory viruses. Laboratory test. No microbiology test is usually required. During the influenza season or in case of outbreaks, a nasopharyngeal swab to test for influenza could be considered. In uncertain cases, some experts advocate the use of biomarkers of infection, such as C-reactive protein and procalcitonin, to differentiate viral bronchitis from bacterial pneumonia. But these add costs and can also result in inappropriate prescribing due to the limited sensitivity and specificity of these tests. Surveillance of circulating respiratory viruses can be useful to predict and follow epidemics and outbreaks. For example, SARS-CoV-2, influenza virus, and respiratory syncytial virus. Imaging is usually not needed. Treatment. No antibiotic care. Symptomatic treatment. Bronchodilators in case of wheezing, mucolytic or antitussive agents can be considered based on local practices and patient preferences. Patients should be informed that the great majority of cases are self-limiting and of viral origin. Also, cough can persist for several weeks. Symptomatic treatment for adults includes medicines listed in alphabetical order, and they should be considered equal treatment options. Ibuprofen or paracetamol, also known as acetaminophen. Symptomatic treatment for children should be administered according to weight and age. Ibuprofen should not be used if the child is less than 3 months of age. Alternatively, paracetamol or acetaminophen can be used. Antibiotic treatment is not recommended and should be avoided, as there is no evidence of a significant clinical benefit. Additionally, there is a risk of side effects from antibiotics.